Hi, I'm Dr. Latika Chugh, working in the Department of Community Medicine, Narayana Medical College, Nellore, and today we are here to share some information about rabies to celebrate the World Rabies Day, which is celebrated on 28th of September every year. It also marks the death anniversary of Louis Pasteur, who developed the first rabies vaccine. Rabies is an acute viral disease and that causes fatal brain infection in humans. In India, the disease is mainly transmitted by the bite of infected rabid animals. 97% of the human rabies cases are reported because of the dog bites, followed by cats, jackals, mongoose. Other animals such as horses, donkeys, monkeys, cows, pigs also can report rabies cases. But if you are bitten by rodents such as rats, rabbits or birds and bats, they are occasionally not found to cause rabies in humans in India. For India, it is estimated that 20,000 of rabies deaths occur each year and 17.4 animal bites are reported every year. So it is a bit of a problem. India accounts for most deaths in Asia, that is 60% of human rabies death, and globally it is 35%. So rabies virus enters into the human body through inoculation of the infectious site with saliva of the animal or through scratches and wounds. Then from there it spreads to the central nervous system. Rabies symptoms begin with non-specific signs such as headache, fever, general weakness or pain and tingling sensation at the site of bite. After that, it progresses to anxiety, development of confusion, hyperactivity, excessive salivation. In some cases, in most cases, people will they will develop a fear of water known as hydrophobia. They will not be able to swallow, even the sight of water will be scary to them, called as hydrophobia. Eventually it leads to coma and death. So what should you do in case a dog bites? First of all, you have to wash the wound with soap and running water for 15 minutes. Then you should apply povidone iodine, Dettol or any other antiseptic available with you and rush to the nearest hospital. You should not apply irritants such as turmeric, lime, salt, oils at the site of bite because it is going to cause more damage. Once you are at the hospital, the doctor will look at the wound and then decide the management. If only touching and feeding was involved and the dog licked at your normal intact skin, then it is called a category 1 exposure and no rabies vaccine is required, just washing the wound is enough. If the dog has nibbled on your uncovered skin or there are minor scratches or abrasions without bleeding, it is called as category 2 exposure and rabies vaccine is required in such cases. But if you get single or multiple scratches that involve all the layers of your skin or if the dog licks on your broken skin where you already had a wound, or if you are bitten by a wild animal, all of these comprise category 3 exposure and in these cases rabies vaccine as well as immunoglobulin is given. Rabies vaccine, how is it given? 0.1 ml of anti-rabies vaccine is administered at 2 sites on your deltoid, which is the upper arm area, on which visits on day 0, that is the day when you report with a dog bite, day 3, day 7 and day 28. So 0, 3, 7, 28. Day 14 is skipped and it is given for category 2 and 3 exposure. Generally, your doctor will also provide a tetanus vaccine of 0.5 ml intramuscularly along with the rabies vaccine on the day you report with the bite wound. So you will get 9 injections. For category 3 exposure or bite on the head, neck or shoulder, doctor will give you anti-rabies immunoglobulin which is infiltrated around the wound. Now why is it given? Because vaccine will take some time to develop immunity. Meanwhile, immunoglobulins will give you direct antigens with antibodies which will fight with the vaccine, with the virus. The wound is kept open and loose suturing is done so that healing comes faster. So you don't want to get so many injections, right? So how do you prevent yourself from getting a dog bite? Dogs generally target small children because they are small and easy targets to get, and the bites happen on face, neck and shoulder, which can become serious. Dogs also easy target is people who are in old age group, because it is difficult for them to move away because of arthritis, weak muscles as well as poor sight. Now some common tips can be followed for avoiding dog bite. That is, first you should know the body language of the dog. If the dog is staring at you, it is snarling and its ears are laid back and the lips are retracted to show the teeth, that means it is provoked. Stay away from such a dog. Do not stare yourself and provoke a dog. Don't leave children unattended in front of dogs. Talk to your children about dogs that look scary or are making some strange sounds. Teach children not to take food or toys away from the dogs. Don't run past a dog, because dogs love to chase people or things. If you have pet dogs, be responsible for them. Get them vaccinated and neutered. Neutered dogs are less likely to bite. Make sure that your local municipality is keeping a check on the population of dogs in your area. So, to conclude, rabies is 100% preventable as long as you report to the hospital on time and quick action is taken to save lives. Thank you.